Welcome to End of Life University on YouTube. Today I'm sharing with you a very lovely conversation I had with an oncologist, Dr. Christina Gomez, and we're talking about a book she wrote, which is a collection of quotes from her cancer patients. She's an amazing doctor. You will wish you could have her as your doctor if you ever need an oncologist. I guarantee you after you hear this conversation. So take a listen. If you haven't already, be sure and subscribe to this channel down below. Also, subscribe and leave a rating and review for the podcast wherever you happen to listen. And go to eoluniversity.com/support, where you can find 3 different ways to make a contribution to help keep this show and the podcast on the air. So we'll move on with my conversation with Dr. Christina Gomez. Today, I'm so happy to welcome my special guest, Dr. Christina Gomez. Dr. Gomez, Christy, is a gastrointestinal medical oncologist at Banner MD Anderson Cancer Center. She studied medicine at the University of Miami Miller School of Medicine and served as assistant professor at Yale University School of Medicine, Smilo Cancer Center. Dr. Gomez is the author of Stopped in My Tracks, a physician's collection of cancer patients' quotes. She was born in Miami, Florida, to Cuban parents and lives in Phoenix, Arizona with her young son, Danny. And you can learn more about her book and her work at her website, ChristinaGomezMD.com. So, Dr. Gomez, Christy, welcome and thanks for joining me.
Thank you so much. Thank you for having me. I'm really honored to spend this time with you.
Thank you. Me too. And I'm so looking forward to our conversation after reading the book and learning more about your work. But I was hoping you'd share with the audience just a little bit of your story and how you ended up choosing oncology as your specialty in medicine.
Thank you for that. It's probably one of my favorite questions or favorite stories because we're taught in medicine that our career chooses us or our specialty and subspecialties sometimes finds us. When I was 5, I said I wanted to be a physician. I don't really remember my pediatrician. Don't know if I fell in love with that there or if this was something bigger than me, right? Born for this, right? Like Dr. Rachel Naomi Remen says that we're born in this lineage of Maimonides. Maybe I was just one of those kids, right? And so, but years later at the University of Miami, studying medicine, I knew I wanted to be an internist. I was still fascinated by the whole body. But then I knew subspecialty was my calling. It was an interesting time in medicine. And I think oncology chose me for 2 reasons. One, we were at the advent of targeted therapy, of monoclonal antibodies, of tyrosine kinase inhibitors, of really harnessing what cells do all the time, but how we can intervene. And I remember that we were at the cusp of that, and I knew it was exciting. But one day, as an intern in residency, so in internal medicine, I met an oncology patient. If I close my eyes, I still see him. He was suffering from small cell lung cancer, and he was undergoing aggressive chemotherapy and severe prolonged neutropenia. And I was taught to see him maybe once or twice a day because he was so frail, so sick, things could change. And I got to know him. And his light and his fire to survive, to bounce back and be ready for the next cycle of chemotherapy was why I knew I wanted to spend 8 hours plus of my days with patients like him.
Mm. Wow, that's such a beautiful story. And I love that you talked about how medicine calls you or your specialty calls you where where you belong and where the best fit is. Uh,
Truly.
yeah, that's so special, and particularly in oncology, because at least I view it as one of the most challenging and most difficult specialties. We need special people like you who are a good fit and who feel comfortable working in that area.
Thank you. Thank you. I bow to my colleagues who did surgery or electrophysiology or could do procedures, but my heart is on fire when I sit and chat with them. Know that we're on a journey together. Theirs, mine, ours. Um, Thank you for mentioning the challenge. I think oncology is becoming a little more challenging. Unfortunately, we're seeing younger and younger patients. Maybe young medical students or my professors will say, well, it's that you're getting older too. But but no, the epidemiology is there. Unfortunately, cancer is arising in younger and younger people. And so I'm having harder conversations, or the hard conversations that maybe we were okay having at age 60, 70, 80. But now I'm having at 20s, 30s, 40s. And that shift, it is truly difficult work, devotional heart work, right?
Yes, yes, absolutely. Well, the heart that you bring to your work shows in your book, which is a collection of quotes from your patients, which it's so precious and it really touched my heart to read it, but also the idea of the time that you take and the care that you take to really listen to your patients and then to write down things that they say to you. And I wanted you to talk a little bit about what inspired you to start recording things that your patient said to you outside of the medical record, not just their medical symptoms and
Yes,
things, but
yes, yes. So first year medical school, we were taught, right, medicine 101, listening to the patients. And through the years of training and the demands, there's a temptation to rush through the visit or the history, almost finish their sentences. I get it. I know what you're going to say. That type of temptation is there. But I think the invitation to document came early on, that first year medical school. But I was taught or invited to jot down pearls of knowledge, things that are in our medical textbooks, those that need dusting, but that you were seeing at the bedside, that which you had read about, but were seeing in real life, in a patient, a lab result that made sense, right? An anemia that the platelets were higher because the iron deficiency was present, right? Things that made sense and you saw. They asked us to write that and to keep these little notebooks in our white coat pocket.
mm,
I confess, and I hadn't really confessed it until I met my editor and said, I felt guilty. I never could do that. The demands were there. I had to go see another patient. I thought I'd remember it. I'd take it home and maybe jot it down later. And I never did. And I really wrestled with, was I missing learning opportunities by not writing it down? Fast forward into my training or into oncology, into this very journey that really became home for me. I feel like a fish in my ocean because what happened was I wasn't documenting how a colon cancer was found with bacteremia, or how a breast cancer was found, or a lymph node in the neck with a gentleman as he was shaving. All those things we were taught. What I started to write down were things that patients said because I literally was stopped in my tracks. I had to pause because their words meant something to me. Their words were new, right? It was really someone's angle. What's the patient's words, the patient's experience in this? And there they become my teachers, like I was asked to jot down that the patient is the true teacher. Um, but I started to jot down right before them. I say, wait, can you say that again?
mm,
And it may have been just what the chemo tasted like, felt like, what it felt like to hear the diagnosis or the prognosis, or what it all felt like. But I knew they were saying something to me that was unique and perhaps universal in the same breath. So it was that I jotted down. And I didn't have the little booklet. It was from the paper on the exam table, or a paper towel that I would reach for, or their very intake form. And all of that I collected. And I shared with them, I'm going to write a book one day, never knowing how it would evolve, but I knew there was something there. And then I shared this in some writing hour, physician writing hour, anecdote or antidote to burnout. And it was with a physician author. And she said, let's compile these. Let's tease these out. So I love that you asked me that, but it kind of came about from the very beginning, but through the trajectory of my career.
That's beautiful. Somehow I picture you arriving home at night with the pockets of your white coat, finding, oh, a napkin here, a paper towel there, stuffed in that you've been carrying around all day with you.
It really happened that way. When it was time to compile them, I had to kind of transpose them into a Word document, and it was fun to iron out the crinkled paper and very a little bit old school, right?
Yeah, but I just love that. And I do want to say again, for at least in my experience as a physician also, it you have to intentionally slow down and really listen to capture these pearls that patients say to you. And so I really honor you for that in the midst of a busy practice, when there's lots of demands on your time and probably lots of crises happening, that you hear the pearls when they're spoken, you recognize it, and you can slow down enough to ask them to repeat it and write it down. And that's really admirable.
Well, I thank you, and I bow to, I guess, my training and our continued training at Yale. There were these, efforts in oncology to kind of grow our formation, if you will. We were already attendings and teaching, but to practice the pause, right, to really listen, or I guess my hope is that in all parts of our career and early training, or now in hospice care or in oncology care, that we remember that healing happens there. That I'm not just refilling meds or reviewing labs and proceeding to the next cycle of chemotherapy, but that maybe something really happens in being heard and being understood. Or today, saying to a patient, I want to have the hard conversation with you because I want it to be me and not some ER physician that you don't know. And today was busy and I had to run out and go get my son. And she was the last patient of the day, but I realized that things were changing. And I said, I got to stop here because in the next few weeks, she may be in an ER and it has to be on me too. So that we have that opportunity, that healing happens there or preparation happens there. So I don't know. I hope that that's true. That part of the journey happens in the listening.
Oh, I totally believe that myself. And I loved, so you'll have to give me the exact quote, but I know from the book, a patient's husband said to you, "We have cancer," referring to the fact that he is also on the cancer journey with his wife, but you are on that journey as well. You're part of that journey. And that to me is a really powerful recognition that you've come together with this patient and their family, and you are all going through this cancer together.
It's really a gift. There was a time when I almost went into maternal fetal medicine because I'd have more than one patient at the time. But as you highlighted, or we were able to share, oncology chose me, and cancer affects the entire family. Just the word, the diagnosis, uh, the good days and bad days affect the partners, the caregivers, the kids. Just today, I had a patient who's caregiving for her mom as she's on her cancer journey. And
Wow.
I asked her, "How's mom?" And she's like, "Mom doesn't know about this second round of chemo." But I ask about her because she lives with her and she's taking care of her mom. So that patient is a lovely, lovely gentleman uh, who I gifted the book to because his wife is in the book and he's in the book. But one day I approached him as we were saying goodbye, and I reached my hand out and I said, "Hey, we're here for you too." And it just emerged. Those words emerged from him. He's like, "Thank you, because we have cancer." He was well aware that he was on this journey with her. And I was honored that I sit with him, and he always shared her side effects, her good days. He was part of the visit. Uh, she's now passed, and I've been able to talk to him a few times, and he says that this book is something that he will treasure because it's legacy of her time, of our time. It's almost like her words in print. It's interesting because it's really his words. We have cancer. And maybe the invitation is also for us providers,
Mhm.
right? In some way, I'm carrying now the discussion with young patients and end of life. And what's that doing to us? So we carry this because we walk with our patients intimately.
Mm. Wow, that is so profound, and it reminds me, I mean, as a family doctor and then a hospice doctor, I wasn't in the position myself very often of delivering this kind of news to patients, but I once had a test result come back for a patient that said this is likely cancer, and I knew the I wanted to call the patient. I knew I would need to convey this information to the patient, but it was a Friday, and she had told me she and her husband were going on a camping trip, and would have no cell phone service. So she said, I'll be unavailable until Monday. And so I thought, wow, like I'm carrying this knowledge for her. I know something that she doesn't know yet. The pathologist and I know this. And I thought of how often you are in that situation. You know the diagnosis and you know what's happening probably a lot of times before the patient does. And you carry it, you carry it in your own heart for them until the right time comes when you give them that message.
It's such a beautiful angle. Thank you. You made me think of the many Fridays or Saturday mornings that I've reviewed results and wondered which is better, to know now, ease the waiting, or maybe the kids are in town, maybe they took a trip, just a road trip, but to bearers of this news, the good and the bad, haven't thought about that. I'm working on a retreat based on the book in October for caregivers, providers, everyone on the cancer journey, partners, patients, survivors, chaplains. And this is a new angle, right? Not only what we carry in discussing, but what we hold for a while. Um, hadn't really thought about that, right? What we
Yeah.
carry in our hearts, in our cells.
Yes, yes. That what we carry for our patients until the time is just right to have the conversation. And it made me think also of one of the things that you wrote down is um, how much do patients really want to know as they're approaching the end of life? And so I think those of us who already work in hospice, we feel like, well, everyone needs to know everything. They should have all the information. They should know they're at the end of life. But honestly, some people don't want to know that. And I'd love to hear about that from your perspective.
It's been a gift to do medicine across our country because it's a little bit regional, it's a little bit cultural, but at the core, it's universal. So in my family, right, Hispanic, Catholic, they don't want to talk about it, right? We believe in this creator who receives us, and yet we don't want to talk about that moment. So I grew up with that at home, and then our training that invites us to all parts of life, beginning and end. Then I choose oncology, or it chooses me. And at first, I'll confess that I thought patients didn't want to know. I thought that that would crush them, that hope would be shattered and that the healing would be impaired, or that the hope in the journey would somehow be interrupted. And yet patients have taught me they want to know. And I invite them, or I walk with them to see when they want to know and how much they want to know. And I ask that question, how much do you want to know? Or a relative will ask, so doc, what's the prognosis? What's the timeline? And then I look to my patient and I say, do you want to have this conversation now? Do you want to know? And some patients say, I don't want to know. Some patients say, they look over to their wife and say, you guys can talk at another time. Just yesterday, I had a patient, we had results, and I knew they were waiting. They put me on speaker. He's the patient, she's the wife. And we talked for a while. And then he left the room and she said, I need to know. He says he doesn't want to know, but I need to know. And then I'll be ready if it happens on a Friday night as we're watching TV, that I'll be ready. Hey, Dr. Wyatt, the angle I've taken recently is, what do the books say? Because they're Googling this, right?
That's true.
Is the prognosis 6 months? Is the prognosis 2 years? And yet every day, new treatments are coming to light. Clinical trials are opening. So that's the hope that I've heard you talk about also a little bit, right? Real hope, false hope. Which do we deal with? Where I say, well, this is what the book shows, but just October, we have a new medication. I've only used it 3 times, but it just got FDA approved. So that every day there's something new. Now, the patient just yesterday, things are evolving before his eligibility for a clinical trial may be available. So that's the hard conversation. How much do they really want to know? I ask them. And in my 15 years in oncology, I've learned they want to know more than I thought. But preparation or inviting them to do it how they want is then a gift for the we in the cancer journey, right? For both the patient, the partners, the caregivers, the children. The children. I had a patient who has 4 kids, 2 in college, 2 at home. The wife calls them, we've got the bigs that are coming home and we've got the littles at home. And I said, how much do they know? And how much do you want to know for them who are witnessing this?
Wow. I can just see how much sensitivity it takes to be able to recognize that for each patient, to really listen and hear what they want, and then to follow their wishes so carefully and gently as you give them the information they need to have, to the extent that they are willing to receive it, it sounds like.
And you would give me the green light on that, right? Right before we get to hospice, right? Because we're known for either delaying this conversation, and I want to hope that we are bridging our work, right? Oncology and your hospice work. Would you agree with me that in doses that the patients are ready or request?
Oh yes, absolutely. That's one thing I wanted to bring up, that I think sometimes oncologists are sometimes stereotyped in a way as delaying conversations about end of life issues, about palliative care or hospice care. And but that comes from those of us on the other end of it who are thinking, oh, this patient should have come to us months ago, but us not recognizing, was this a patient that said, I don't want to know, I'm happy in treatment and I want to feel all positive about my treatment. And so you're walking that narrow line, trying to meet all of the patient's needs. And it might be that you would have had discussions with patients earlier if they had let you know they wanted to have that discussion.
Yeah. Thank you for that. There's something else that spurred my thought as you were sharing. We may have had the conversation, but patients are living longer with cancer and with treatments. Just yesterday, I had a patient who's been on the metastatic journey for 4 years.
Wow.
Now that, yeah, 4 years, it becomes routine. It becomes a way of life. And so if the scan changes, and I have this discussion of, let's try something else, or how do you feel about that? Or how's your body? Is it ready for something else? They're like, yeah, but is it ever going to go away? And that's a conversation that at the beginning, now years later, was maybe had, but because it becomes routine, it becomes part of muscle memory of just chemotherapy every 2 weeks. The conversation is maybe sidelined. And so when I had it again yesterday, it was almost like the first days. It's like,
Mm.
but I thought I was doing this every week or every 2 weeks for 4 years because we were going to eradicate this. So it's almost like, what do we do in our day to day, knowing it's our day to day, but hoping it'll change. And what is change, right? Delaying it, suppressing it, living with cancer. The gift of that, or the gift of targeted therapies and what we've been able to harness. But in the end, it's just that until it changes, until resistance arises, or until the body says, that's too much.
Yeah.
So
And how do you personally kind of walk that line around hope? Because, well, first of all, we know that hope is really powerful and is can really help people heal when they have hope. And how do you walk the line helping people feel, I guess I already wrote it down in the question, realistic hope, so that they
yeah,
don't ascribe to false hopes, and hope for something that maybe isn't going to be possible, but maintain their hope about what is actually possible.
yeah. So that question, I think, is twofold. One, I live for options. My hope is that there's another line of therapy, right? Because people are younger, because people remain fit enough for next lines of therapy, so that there be more lines of therapy, right? For an oncologist, that whole idea of there's not much else to do, or we've exhausted approved therapies or clinical trials, is the real pain, the heaviness of all of this. But the other hope that this works, hope that you can tolerate it, or the hopes that there's time to achieve what you want. I had a patient in Florida when I was down there. I'll never forget him. Metastatic pancreas cancer, a fabulous wife, very supportive people. And his disease was progressing, or treatment was already taking its toll. And I had the conversation of, hey, what do you wish? What are your goals, right? Is it the granddaughter's birth, the daughter's wedding? What's important to you? And he surprised me. He said, I want to go to my 50th or 60th high school reunion. I couldn't believe it, right? High school reunion, metastatic pancreas cancer. But it was amazing. We were in Florida. He was retired there and a snowbird. I didn't know if I could get him up there in time, but he did. He lived for that, went to the high school reunion, came back, and signed up with hospice. I visited him in his home with a hospital bed in the living room, a view of the golf course, and I was able to see him return from the high school reunion in hospice care, comfortable. I sat at the kitchen table with his wife and just visited with her. So the gift of realistic hope, could we make the trip? Or can we make it happen? Yes, right? Realistically, sometimes I wonder about some of these trips, but we can make it happen. Or so there's that. I'm honest about the false hope, right? I don't want to ever give false hope. And so I say, I don't know. Patients have surprised me. Your heart and your brain and your lungs are okay, but your liver may fail. Your kidneys are hurt. And so we're more than just one organ. I have to treat the whole person, not just the cancer. So I say those things. I can't promise years. I can't maybe promise months, but let's get good weeks. So I try to compartmentalize that in things. I talk about, is it time to bring the kids or is it time to call a family? Yes. Right? Is it time to do that now? I have young people still working because insurance or because, so I say, it's maybe time to talk to our bosses. It's time to be home, or call on disability or call on whatever uh, options we have with further support, because young people are working to the very end.
Mm.
So hope in, yes, there's a new line of therapy. Hope in, your body is stronger than this cancer, right? You're young enough, lungs and heart still functioning. But the realistic hope that, hey, this can change at any time, because the liver may fail or the kidneys may fail or the chemo may fail, but you didn't fail, right? That was really important to me. A mentor, you didn't fail. The chemo failed us.
Yeah, I think that's one of the things that that I've always objected to. I often see this in obituaries that this person lost their battle to cancer, and I really don't like that. I don't like that way of looking at it at all, because it, that's not what it was. It wasn't a failure, as you said. It wasn't losing a fight.
They already won. I'm the lucky one, right? I get to walk with patients who say things like, I wish I could be in remission in my mind, right? That in her mind, psychologically, she wanted to be on remission. She almost didn't even care that the metastatic cancer wasn't going to go in remission, but that remission in her mind. Or Dr. Gomez, uh, what is it that this young patient told me at her deathbed? Energy can neither be created nor destroyed. I'm not going anywhere. She already won.
Wow.
Or the patient that really taught me time after time, page after page, how this chemo feels, right? Everything tastes like sawdust. Or my feet feel like they're wrapped in bubble wrap. Or it feels like I have pop rocks in my mouth, right? These people already won this journey, one for themselves, two, they're teaching my future patients. And they're teaching me to be doctor, right? Teacher, and continuing to teach, hey, this is what it may feel like. So yeah, I agree with you. I have the same school of thought.
Yeah. Oh, it's so beautiful. I was thinking of one, I wrote down some of the things that touched me. One of the patients talked about going in for chemotherapy as a spa day. And I thought that what a great attitude to have. Like, oh, I'm here for a spa day. They're giving me a cocktail. And
Yeah, and I bow to my team. That makes her feel that way, right? It takes a village. But she was perfect. She's like, they give me a chair, they give me a cocktail, right? Our medical cocktail. They give me a blanket, and they give me snacks. Or another patient who said, I come here for the hugs and the drugs.
mm,
Right? Thank you, Dr. Wyatt. Please, if you have another quote that stood out, I'm happy to share her story or their story.
this one was really profound. I think you said this was a person who loved hiking, and you asked what their favorite place had been that they had ever visited, and the person said, "Right where I'm at." And that, for me, that's really profound wisdom, to be able to be right here where you are and loving this moment for what it contains. That's really deep.
So these patients, or she and her husband, are amazing hikers. The entire Pacific coast, the entire Arizona trail. Like I'm still discovering these trails that she talks about. They Amazon or call on provisions to be delivered to a nearby town. Like, these are real hikers. So I was asking, And yet she gave me the wisdom of what patients teach us, which is right where I'm at, right present moment,
Hmm.
that this is the patient that matters. This is the journey that matters. This is what I am called to discover, right? Whoever's sitting with me at the waiting room, my next patient, uh, my young son coming home from school, this conversation with you, right where I'm at, is where life happens. So she blew me away. I thought she was going to say this journey, this corner, this trail. No, right
Wow.
where I'm at.
Wow. I mean, that is the wisdom that each one of us needs to take with us throughout our day-to-day lives, whatever's happening or wherever we are, to remember to just be content with this moment, whatever it's offering us.
And in hospice work, end of life work, the gift to remind them that, right? There's a patient today I spoke to, he's on hospice, and I hung up by saying, hey, you're enjoying every day, right? And he said, yep, it's me and my wife. Hospice is coming. Thanks for this phone call.
Mm.
But yeah, we're just going to enjoy every day. Uh, that's it, right? The movie, the visitor, the food you want, I invite them in home hospice to stay home, right? So that they have their pets or their smell of their blanket or maybe the cultural cooking, right? The home cooked meals.
Mhm.
I don't know. So I'm an adoptive mom, so cultural and home cooked meals are important, right? Maybe that's where that came from. But and you can correct me, but that maybe there's healing in that too.
Oh, absolutely. And I have to say, like, I'm so impressed that you made a home visit to your patient who is on hospice because, again, in our world, too often we hear patients tell us these terrible stories that my oncologist said, "Oh, if you're going to hospice, I'll never see you again. Goodbye." And that's just crushing to hear and to know that you took the time to visit your patient. That's so beautiful and so sweet.
So I share with them that I'll always be their doctor. If I transition care to a hospice physician or hospice services, um, I share with them that what we've walked remains, and that once your physician, always your physician, right? I get a chance to do that um, because it's the truth, right? And many times I don't hear from them again. Um, Later today, I have to call someone's daughter. She went to hospice and she just transitioned or she just passed. And I can't wait to speak to her daughter because she was part of every visit. And now it's my turn to call her. And so and we remain their doctors, right? Some patients in oncology also seek us for second opinions, and I tell them to keep us for second opinions throughout their journey, right? That I could be the pinch hitter, or that I'm happy to run something. They're happy to run something by me if it's a scan, or later on if they need another line of therapy or a clinical trial. But that at the end, we just transition care to our colleagues in hospice, but that we remain theirs. And so, yeah, I haven't had a chance to visit many more, right? Now I'm a parent, um, but thank you for that. It was pivotal for me, and to see that we got to do what he wanted to do, or he was
Mhm.
able to accomplish that, and be
Yes.
present for the family.
Yes. Yeah. Oh, that was such a good story. Are there any quotes from the book that are especially powerful for you or that you would say have we've already talked about some, but other quotes that have informed your journey as a doctor?
One that stands out to me all the time is when I asked a patient, "How are you?" We're taught to really ask open-ended questions. How are you? And time and again in the book, the answers are so varied. Here I am asking literally, how are you with respect to treatment and the journey and the cancer? And they have blown my mind with their answers, right? One of them who said, all I feel is lonely,
Mm.
or I'm grateful for this cancer, or, you know, less hair, more weight, right? The way that they've been creative in their answer. But but the one that said, all I feel is loneliness. And she had a long-standing CLL, chronic leukemia. I would see her every few months. Her disease was going to span years. So she's on this cancer journey, and yet it had nothing to do with the cancer. The visit was about how she felt very alone
Mm.
and lonely, and that the visits were a gift for her to sit and talk. And this is true for every physician, or I hope that some, I don't know, resident or medical student or someone early in our career or late in our career that needs to hear it again, that we're invited to that. That's what she said, and that always stands out to me. Her quote, I'll never forget her. Uh, and I got a chance to see her for a long time because chronic leukemia.
Yeah, and to
Let's
know that
see, yeah.
we're part of the antidote to her loneliness by providing her a place to come and someone who cared about her and would listen to her.
Thank you. Yeah, yeah. Um, the other spectrum of hospice, or the other side of it, is patients who can almost forget that they have cancer. A couple of people have said that either their disbelief or that we're targeting their side effects so well that they say, I almost forget, or
Mm.
some days I forget I have cancer. What a gift, even in hospice care, right? To almost forget that we're dying, right? We're all on this journey, but to be living, right? That we were able to, a couple of guys, it was the male patients who said that. I almost forget I have cancer. Um, that maybe hospice can be that too, right? That we're really living. Uh, Another patient said, I want to live my dying, stopped treatment
Mm.
and finished her memoir.
Wow.
Uh, so I think these are the ones that stand out because I get to hear this. I have a patient who has that tattooed on her arm. I get to, right?
Wow.
That we get to do this, right? We get to do this work, or we get to be in, you know, the drop off line with our children, but because we can, but that we get to come to the cancer center, or that we get to walk with them. I don't know, uh, that whole shift in focus.
I really like that way of looking at it because not everyone experiences what they're going through. And to be able to look at it as what if this is something kind of special that is part of my life that not everyone does, not everyone goes through that. So I want to view it as how can I get the most out of this experience that I can, whatever that means.
I hear it time and again where patients offer themselves to other patients. Like they'll say, Dr. Gomez, if I can speak to your other patients, right? We're in
Mm.
a world of HIPAA, but if I can speak to your other patients and share my journey, or I understand that this clinical trial may or may not help me, but it'll answer the question for someone else. So selfless. I don't know how much time we have, but here's another patient who said, I just opened a $10,000 life insurance policy. I pay $9.99 a month for my friend who brings me to the cancer center
Oh.
because I can't repay her now, but when I'm gone. So, what has moved me about patients and that I tried to capture in the book is that selfless, selfless, or I don't want to be a burden to my family, or I'll buy this insurance policy for my caregiver, my friend who's driving me. I have no one else. I can't pay her now, but maybe one day.
Mm.
So these stories I get to listen to, and I was able to jot down, and I hope that here sharing with you inspires someone else, or provides hope, or I don't know, gifts another with the journey.
Yeah, and the book is beautiful. It's simple and easy to read. It's a book of quotes, literally. But you have some illustrations that go with some of the quotes that are also very nice. And I It seems like it would be a great gift to give to someone, maybe someone who's experiencing a cancer journey, whether it's an actual patient or a loved one, um, because of just the wisdom that it contains and the wisdom of other patients' words that you now have made available. You've helped share them and open them up to others.
Thank you. Thank you. It is a simple book. Um, I wanted to keep it the patient's quotes and not the story or fluff it up. I have a patient right now who got the book. She purchased it. She found me online. And she said, I read and reread them before I started my chemo, just in case I got the mouth sores or the neuropathy. That patients described it in a certain way. So I am so grateful to her. But I pray that for caregivers, for students, for families in grief, that it may provide, I don't know, a balm, right, or a drop of water in this difficult time. That some of them are witty and funny and joyful, and some of them are really sad. One says, "Give me an IV of prosecco. That's how I want to go." And another one says, "I got all the pain, but she got all the suffering." You know,
Mm,
and to be able to carry both, because life is both.
so true. So true. Well, I want to remind listeners that we're talking about Dr. Christina Gomez's book, Stopped in My Tracks, a physician's collection of cancer patients' quotes. And maybe talk about that title, Stopped in My Tracks, because I imagine that must have been what you felt as you heard these quotes.
I really did. It really did, right? I grew up with kids say the darndest things type of show, knowing that there's power in quotes. I was trained in high school to use quotes to capture in the essay what you want to relay. But patients literally stopped me. Right? I could be in a busy day or be tempted to rush through the visit, 15-minute visits. I'm late. The infusion nurse is calling because they need to be up there. But the things they said, right? All I feel is loneliness. Literally stops me. Or thank you, doctor, because we have cancer. Stopped me in my tracks, asked me to ask them to say it again, give me the time to jot it down because I knew there was a life lesson here. Uh, so stopped in my tracks is an invitation too, right? To be like the patient who says, wherever I'm at, to not miss the moments, right? Parents say that all the time. And I'm new to parenting because I'm an adoptive parent, and I'm like, I don't know that I'm enjoying every moment of this, but to pause, right? And and recognize that this is now. Stop in our tracks, look around, right? Like Hamilton, right? Look around, right? How
Yeah.
lucky we are
Mm.
to be alive right now. Um, I don't know. I think that's where it came. The illustration was some of my sketching, and then we had an illustrator who aided me in capturing some of what the patient said, but in drawings. And it's really just these a sketch of feet paused in this journey. So
Mm.
thank you. Yeah, thank you for that.
Well, it's a beautiful book. And I think it would be a great gift, like I said, for maybe a patient or family member on a cancer journey, but also for healthcare providers, caregivers, even for hospice workers and probably other oncologists and med students, like you mentioned, as just a reminder, a reminder for all of us to stop, listen deeply, and hear these pearls that are out there all the time. Like every day, I'm sure you hear something that's really special.
And everywhere in our life, right? Like what happens at the grocery store line, right? Or what happens when our kid is going to bed and says, those last final words of the day, or our patients' last words, right? In hospice work and end of life. So it is a simple book, but I hope that it can touch lives and everyone in this journey. Stopped in my tracks. It's available on Amazon. It's available at itasca.com. It's available through clicks on my website,
Mm.
ChristinaGomezMD.com. And if you know someone that it can uh, I don't know, encourage, inspire. I bow to my colleagues in medicine who teach students and just bought a batch for their residents. I really am so grateful because the gift begins then, or the mission begins then, right? Medicine 101, to really listen.
Mm.
That the patient knows. The patient knows what's happening and they'll guide their care.
Mm. Wow, that's so true. That I would love to see more of that happening. Let's buy these books as gifts for students in training. And then about you mentioned a retreat. Is it in October that you're hosting? And that sounds really amazing. How can people find out more about that?
Thank you. Thank you. It too will be on my website. It's in Camp Washington in Connecticut. So some of my stomping grounds was up there and my community is there. I'm in Phoenix now. So in October, the best time of the year in Connecticut, the fall leaves, right? The reminder of all that needs to shift and transition and change. Camp Washington is hosting us. It's an overnight retreat, October 11 and 12. CampWashington.com is also where we can find, I think it's .com or .org, but Camp Washington in Connecticut, or through my website. It's a retreat, a weekend of reflection, a gathering, everyone on this journey, chaplains, providers, hospice ministers, patients, caregivers, survivors, wherever you are in your journey, newly diagnosed or stopping treatment. We need to learn from each other. I dream that it'll be a sharing, maybe someone's oncologist never said something, or someone's partner never heard the angle that another person is sharing in the retreat. But a weekend of reflection, healing. The book will be our guide. That what are the words you wish to say, and to whom? Right? To anyone on this journey. So I've got two chaplains, a physician and priest is joining us. A chaplain is joining us. I'll be there and I'll share how this came to be, but mostly the retreat is whoever comes.
Mm.
And that we raise each other, like my mentor taught me, that we raise each other.
Wow. That sounds amazing. So I'm going to put links on the show notes for this interview, so people can go there and click because that sounds
Thank you.
wonderful, wonderful. And
Thank you so
I know a few
much.
people I'd love to recommend it to. So
Thank you. East Coast, it's Connecticut, October 11 and 12. The lodging, the camp is beautiful. There's private lodging. Take a peek. I'd love to meet you all.
mm, fabulous. Well, Christy, what a pleasure it has been to talk with you, and I'm just so honored to meet you. We're kindred spirits in different specialties, but as you said, I feel like this conversation really bridges any gaps that were there in the past, and I hope we can continue that and carry on, be collaborators going forward.
I'd love that. I'd love that in your work. And this is what we need. Thank you for having me. It's an honor to meet you and to meet your guests, if you will, right? To be able to share this journey. I'd love to walk with you. Thanks for hosting me.
Oh, you're so very welcome. Well, good luck. I'm hoping everyone listening will get a copy of your book.
Thank you. Stopped in my tracks. I'm stopped in my tracks by this conversation. Thank you.
You're so welcome. I hope you enjoyed that conversation with Dr. Gomez Christie as much as I enjoyed talking with her. And also, I hope that you'll get a copy of her book, Stopped in My Tracks, because it will make a great gift, but it will also be inspiring to you as well. So I'll be back next time with another conversation for you. Until then, take care and be well.